I want to bring in the leader of the federal Green Party, Annamie Paul. She's calling on the Prime Minister to curb COVID confusion. Ms. Paul says the country should speak with one voice rather than through a patchwork of measures. Hi, Ms. Paul. Good to see you as always.
Good to see you, Vashti.
I appreciate you making the time. I wanted to get into this proposal because I think it certainly acknowledges something that a lot of Canadians are talking about, which is it's really hard 7 months in or 8 months into all of this to process all the different information we're getting versus the beginning when it was fairly consistent across the country. I'm wondering how you think a task force, a national task force, could address that, though.
It can address it by simple things, by establishing a national coding system that's used across the country so that we know region to region what it means to be in yellow, red, orange, green, whatever the colors are. It could speak with one voice in terms of when people should wear masks and when they shouldn't. It could give consistent messaging throughout the rest of the pandemic about the ways in which people can keep themselves safe and keep their communities safe. And that's exactly what's missing now.
So my guess is, just based on consuming all these different press conferences every day for so long now and interviewing many of the different local public health officials, is there would be pushback to that idea because they are very protective of local jurisdiction, and they want to be able to say, if Toronto is worse than Hamilton, then Toronto should have the ability to bring in, for example, its own set of restrictions, and so should Hamilton. What do you do to in the scenario you paint, sort of combat what would be some backlash from premiers and local politicians?
Well, we're not suggesting a one-size-fits-all policy for all of Canada. What we're saying is that there needs to be a standardization of codification and information. And then within that, you look at the local reality. And if a region is doing better than another, then you have the protocols that apply to that region. And in terms of pushback, there really should only be one question that every single politician and every single health official is asking themselves, which is, what is going to keep the most people in Canada safe? That's the only question that should be asked at this moment. This is not a question of jurisdiction. This is a national emergency. It requires a national solution.
Yeah, I take that point. I guess from their perspective, the argument that they've put forward so far is that they are best qualified to answer those questions for their own jurisdiction.
And my response would be that, and you just mentioned it, Vashti, just before you came back, that we do not have this pandemic under control, that we are setting records all across the country. Part of that is due to the mixed messaging and confusion. And I refuse to believe that we are less capable of protecting people in our communities in Canada than they have been in Germany, in Australia, in New Zealand, in South Korea, in all the places where we have doubled or tripled or quadrupled their rates of infection.
Is this different than what Public Health Canada is already doing? Because there is sort of a coordinating function through Dr. Tam, for example, who comes out and delivers one message. They do coordinate some of the action around PPE, around vaccines, and just in general around the province's responses. Would this be dramatically different than that?
It would indeed. It would be a coordinated national response. It would be coordinated national messaging. It would be coordinated national codification. I live in Ontario, and what I see is that we have our hardworking Toronto public health officials that give certain guidelines. Those guidelines sometimes are acknowledged and respected by the provincial government. Sometimes they're not. And then sometimes they're contradicted by the federal government. And I gave the example of my by-election where people in Toronto were told to stay indoors, to avoid contact with anyone outside of their immediate family and only go out for essential services. And then at the same time, we had the federal government saying that it was perfectly fine and perfectly safe for them to go out and vote in the election. And so it's that kind of contradictory messaging that is putting people at risk. And it's one of the things that's preventing us from breaking this second wave and bending the curve.
Have you had any discussions with any of your federal counterparts around the issue?
The Green Party is always ready to talk with our counterparts about this. This is something that transcends politics. This is one of those moments of national unity. We have not been in such a state of crisis and emergency for about 80 years. And so this is something, again, where we need to make sure that there are no partisan considerations at all, that we're really just talking about what is in the best interest of people. And I'm hoping, again, that we can return to two things. First, respecting the science. And we have strayed from that, unfortunately. And this is why we do need a task force of scientists guiding our approach to the pandemic. And two, we need to make sure that we are working in a cross-partisan way on behalf of people in Canada.
Okay, Ms. Paul, I'll leave it there. I appreciate your time this evening very much.
Thanks so much, Vashi.
Annamie Paul is the leader of the Federal Green Party. She joined us from Toronto. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.